Have you ever met with a client and after that you are emotionally drained, exhausted, feeling that emotional pain and mentally confused? And if you're someone who's starting your journey, I need to give you a heads up and a caution that after every session, you need not to be emotionally absorbed by the client. But for that, what need to be done? Because over the time, the emotions we are carrying from a client, the carryovers affect our decision, affect our focus, our attention, our empathy, and there is also compassion burnout. If we are too much engrossed, if we are too much involved in the emotions of our client. Hi everyone, I'm Dr. Aanchal, founder of Therapy Trailblazer Academy, where I help budding psychologists become client ready, ethical, focus, and confidence. So, in this video, I will walk you through 3 minutes formula in which, as a therapist, as a budding psychologist, you need to learn to regulate your emotions after every session. Therapists are generally trained to regulate others, but very few know how to regulate their own emotions. I'm that trained one. If not, worry not. By the end of this video, you will know how to regulate your emotions in 180 seconds, right? So, after every intervention, after every anxiety, depression, panic patients we generally deal with, what happens is we are also drained. Uh, we have also come across a case of the psychiatrist in Noida. She did a suicide because she was also dealing with depression. I've also come across very occasions calls from my friends and fellow psychologists asking, ma'am, what should I do to prevent myself? Because whatever the client is saying is happening with me. All the things. Why it is happening? Because you are absorbing the energy. You are becoming the absorber. You are not having a boundary. You're not maybe not regulating your emotions wisely or carefully. Let us understand why it matters. Okay, so what happens if we are absorbing their emotions? They're becoming an emotional carryover. What is the cost of it? Like I said, same things keep on happening. We become anxious, we become confused, we feel burnout, and it is very natural for a therapist to attune to the client. Sometimes we feel, oh, this is my story. So researchers suggest that observing other person's emotions can actually activate overlapping neural systems which is involved in empathy and also our social understanding. Because we being human are being empathetic, being therapists are too empathetic and compassionate, and our brain is constantly asking, what is this person feeling? What if I am have been in his in his shoes? What will be my feelings? And that's essential for therapy, as you all know, like compassion, empathy, not sympathy but empathy. But after this entire discussion, are we consciously transitioning ourselves to the next phase, to not to be drained, or their emotional activation is still lingering on with us? We are not able to navigate through our daily issues or daily challenges. We are having difficulty in concentrating. We are having a reduced emotional presence, decision fatigue, irritability, feeling mentally lethargic and full that, okay, I'm done. I can't take, I'm just done. I'm not having stamina to deal with my own family members. You know, after repeated weeks of months of these repetitions and unprocessed activation that can contribute to compassion fatigue, burnout, and secondary traumatic issues in our own life too. Yeah, you heard me right. So that is precisely why in my community I also give this platform for my students, for my budding psychologists to always get along with each other, to keep taking venting out sessions, to keep you doing own emotional regulation skills. We keep doing all this in our community. So if you also want to be the part of my community, the link is shared below, or you can reach out to me over my Instagram channel. Just DM me and just hop on in my community, and you will learn, you will explore, and you will be client ready for sure. Moving on, then empathy becomes too much, becomes overload, and when we forget to regulate our own emotions. So, what is healthy empathy? Healthy empathy is we're telling our clients, I understand your experience. I understand it. Absolutely agree with it. How are you feeling? And emotionally, over identification actually sounds like what? Over identification, like, okay, I am carrying this experience. Oh, I have also been there. Oh, is this me? Is this my mirror? So that distinction matters. Our role is simply to just witness the suffering, not to be a part of it, not to be absorb it, right? So just check. And if you're starting your journey new, you have to be very, very uh, upfront in terms and in very careful in terms of this, that I have to have a strong boundary. I don't have to absorb it. I give my students very crisp formulas before the session and after the session. You have to do these activities. I will be sharing few here as well. So how? Why just shake it off all the stress and emotional regulation doesn't work? Because because we are absorbing it, we are taking it back into our normal life, and somewhere we are also affected. Somewhere we are not simply telling ourselves to move on, because simply we don't want to return to that, because we are not more empowered enough to regulate our emotions. Let's not waste more of time. Let me quickly share the activities with all of you. What exactly the 3-minute reset activity? Okay, our nervous system has different modes. So when therapy involves intense emotions, you know that your sympathetic nervous system becomes activated, and sympathetic nervous system is our nervous system which is calming down our anxiety and panic and the high alert systems, right? So our goal is simply not to suppress the emotion, but to name it and to deal with it, regulate it, maintain it, right? So this is what we are learning here. So that is also called as vagus nerve stimulation. This is something you can also do with your clients, but I will suggest to do it with yourself first. So, but vagus nerve stimulation does what? It lowers your breathing, heartbeat. It helps the recovery after loss, engagement, engage it in different engagement with people, social engagement. When we stimulate vagus nerve, our emotions are also regulated, our heart rate also regulated, our palpitations are normal, our breathing becomes normal. So, what are the different ways to regulate the vagus nervous system? Is simply slower breathings. Think of it like this, that just like a surgeon scrub before surgery. Have you ever seen surgeon is just washing their hands slowly from here to here, transitioning from the ritual between the sessions? First, just washing hands and then slowly wearing one pair of gloves and then another pair of gloves. So that is a reset. So what I call this a neural reset. What do we have to do in this neural reset is first activities grounding. Take a pause, look around, do a formula 5, 4, 3, 2, 1. 5 things you can see, 4 things you can hear, 3 things you can feel, 2 things you can smell, and one positive statement to yourself. 5, 4, 3, 2, 1. When you have to do these activities, I will share this. What are the activities? Understand this. First is pause and do the mindful activity 5, 4, 3, 2, 1. This will shift back from clients' rumination, clients' issues to yourself. Second activity is very my favorite is cut the cord. I generally give to tell it to my clients. I also do it after every session of with my every client. I put a 5 minute meditation where I cut the energy cords, not by candle or something, just meditate and cut those energies and release it from my own body to not to be affected by or absorbed. Even if I have absorbed, I will cut it immediately. And I tell it to all my students, to all my fellow psychologists friends, to keep all my therapists to keep doing this to protect yourself from that. Moving on to third tool, which is touchstone anchor. What do you have to do in this is after every session, either a pen or a stone or your bracelet. Just choose one object and breathe. So we are calling it a touchstone anchor. We are holding that. Let's say we are holding a pen. Okay, and just feel the surface, again mindful, and hold it and breathe 3, 4 breathings and say yourself, I am safe, I am healthy, I am okay. I will still suggest the best activity, best tool is to do cut the cord meditation. If you want, I will share the link of that meditation as well here. Each time you finish it, your session, do one of these tools I'm sharing here, and then you're good to go. You will not be, absorbing a lot of energy. So another tool you have to do is temperature reset. Hold an ice, have a hot, warm cup of water or coffee or a tea, hold it, wash your hands immediately. I have seen one of my very close therapist friend who's in US right now. He taught me this idea of washing the hands after every session. This is your and with an intention that I'm releasing all the negative energies from my body through this water. The water carries away all the filth and all the negative energies. So yeah, you can do this. Washing your hands with the cool water, washing your face, holding a cool drink, holding a warm water, a cup of a warm water like this, and just have an affirmations. Feel the temperature, sensations, release the sensations, right? So these are the cues that actually interrupt our emotional state, and it marks a transition. It totally breaks it down. Moving on to the next tool is proprioceptive reset, where you have to ground yourself physically. This is grounding. I generally suggest my students to do this before the session, not after. In this grounding, yeah, before the session. So maybe, before the start of another session, you can do this. Press your feet firmly onto the ground. If you feel you're on the first floor or second floor, you can close your eyes and you can assume that you are sitting on the ground. So we are rolling down our shoulders. We are pressing our feet, hold like an anchor to the ground. That is important. And we can stretch if you want to, but I will suggest this. You do a 3 or 2 minute grounding meditation. If you can't do meditation, just do hold your firm feet to the ground, to the floor, take deep breaths, relax your shoulders, and movement reminds the nervous system that you are safe in this present moment. Next tool is, like I said, 180-second therapist reset. What is the complete sequential? First, first minute, close all your notes, stand up, stretch a little, take few slow diaphragmatic breaths. Another minute, second minute, practice 5, 4, 3, 2, 1. I've already shared. Hold your touchstone anchor and release your shoulders from your jaws. Release your tension from your jaws and shoulder. That's second minute. Third minute, ask yourself and then quietly say, ask yourself, what belongs to my client goes to that client. What belongs to me stays with me. And then quietly say, I leave this session here. Do it. This is the third minute. And then you can end up saying that I will return fully to my next client. Okay. So this is a very, very subtle way we are creating a psychological boundary, right? Another minute is spatial anchoring, where if possible, you can use different parts of your office intentionally and one space for writing your notes. Maybe, if you have seen a lot of videos, or psychologist is sitting at one space, the notes are there, taking session at one place, some soothing activities at one place, some games at another place. So using different parts of your space, of your time and space of your clinic. So that is, and you can use a different area for seeing another client, so that energy of a previous client is not affecting you and another client as well. Isn't an eye opener for you? Okay, so long term, how can you prevent a long term burnout? Protect or prevent? Small rituals become powerful over time. And out of these 4 or 5 rituals or tools, if you take 3 or 4 and do it every session, this will prevent you from burnout, compassion fatigue, having your own depressive symptoms, or feeling sad or lonely, and other symptoms that your clients are coming up with. This might sound weird to you, but I'm telling you with experience. If you are someone new starting your journey, try to be mindful of this. Create your emotional boundary as well, and not to be affected by their emotions. Right. So constant regulation will definitely help you a journey. Every time after the session, do this, cut the cord. Reduce your cumulative stress. Take help of other colleagues, your friends, your therapists, or a support group. That is why my community and support group really helps and push each other. That if someone is low after the session, just reach out to another person and pull it up. Yeah. Improve concentration. If you're continuously doing it in the long run, our focus, our decision fatigue will not be there. compassion fatigue will not be there. We are very fresh, therapeutic presence in the next session, not affected by the previous session. And at the same time, career satisfaction, we will feel less burnout. Um, Most psychologists, and it is actually our daily activity. We do this and we listen to most of our clients. So it is very common issue and challenge we all face. So if we are continuously doing these rituals, these tools, these anchors, we will not be affected in a longer run. But what stops you? I don't have 3 minutes. I don't have 180 seconds. My sessions are back to back client. My client is waiting outside. I can't do the cut the cord meditation for 5 minutes. Make my wait client. These are all mental limitations. Every 1 minute is better than none. Why a lot of cases of psychologists of suicide and other severe symptoms that for themselves are coming up because we stop taking care of ourselves. So every minute is better than none. Try to do small activities. Figure out 1, 2, 3, 4 minutes activities. Okay, even if your schedule is packed, even if your client is waiting outside, just don't ignore yourself. If you are not fit, if you're not emotionally and mentally safe, then you won't be able to pull the other person out, right? So there are two things that happen. Either you go into their zone or you pull it up to their zone, to your zone. So if your zone is in a highest life state, life force, life form, which Buddha has also explained, then you will be able to, help that client. Else they will not go back hopeful. They will not go back recharged. They will go back with the same energy you are carrying from your another client. Yeah. Then don't think that I will regulate later, maybe by the end of the day. Just don't linger on. Do it immediately. Okay. There are certain ethical reflections as well. Like therapist self-regulation just isn't just self-care. No, it supports competent self-care. So we need to think clearly to be able to take other clients, to be able to curate therapies for our clients, worksheets for our clients, and we have to also respond thoughtfully. If we are so much preoccupied in our own thoughts, we won't be able to respond. We will be so much lost and forgetting about our own needs, about our own care, so much lost that we forget to tell important points to our clients, right? So this can also happen. So very again, a reminder for all of you: small rituals you can do. Slow breathing, diaphragmatic breathing, relax your jaws and shoulders. Grounding before every session. Cut the cord after every session. Little few movements, body movements, or you can write down what you're feeling. What are the things that belongs to the clients? What are the things that belongs to you? And you're moving very mindfully to the next client. All these small rituals, small tools, grounding should not make you emotionally drained. Rather, it will make you emotionally regulated, more sound, and more active in terms of responding to the client and helping the client and bringing the client's potential to the up path. Right? If you really liked this video, subscribe for more such videos. How I can make budding psychologist or client ready psychologist and a confident psychologist. This is what I'm on a mission on. So subscribe for more such videos.